Perfect. Hey Sandy, do you think you can send the next patient in? They're here for the most expensive treatment, the detailed cranial nerve exam. I cannot wait to charge insurance for that. Amazing, bring them on in. Anyway, Sandy, as I was saying about the last patient, I told them that I'll see them again soon. Get it? That's funny. And, oh, hello there. Are you here for the most detailed cranial nerve exam? Perfect. I am going to introduce myself. I am Selene, but you can call me Dr. Brain, but I prefer the latter. Pleasure to meet you. And you're here for the best treatment, and might I say, the most detailed. Please sit down at the medical chair right in front of me. And I'm going to quickly go through what we're going to do today, because this is very detailed. Have you ever had a cranial nerve exam before? I'll tell you everything about it. We're going to go through all the senses of your 12 cranial nerves, starting off with your sense of smell. That's my favorite. We're going to test your eyes, your ocular motor function, meaning your eyes moving, your ears, facial movements, your motor functions, your facial muscular functions, sound, hearing, and basic sensory tests. As well, here is just a more detailed list if you'd like. And if you believe me, I did get my degree off of YouTube University, so you know I'm a professional. Yeah, just don't look too close at it. Okay, good. We're going to first start off with taking some vitals, if that's okay with you. And then we're going to move right on in to testing the first cranial nerve. Okay. Is that okay if I touch your face? You're going to get really tired here during this test because we're trying to find out what could be going on, because based in your chart, it says that you haven't slept well in a very long time, about 2 weeks. We will get down to the bottom of that. It kind of does look like it though, because you do have luxury eye baggage. Yeah, don't worry, it's Chanel. I'm just gonna touch right under your eye, okay? Can you feel that? Yes or no? Okay, other eye. Can you feel that? Yes or no? You can. Okay. I'm going to put my hands right here on the sides of your face. Is that okay with you? Okay. Now I'm just going to move all the way back to the ears. Can you feel that? Good. Any pain or sensitivity? None. Okay, good. And how many hours are you usually using your phone a day? Perhaps over 6 hours. I'm gonna ask you to stop that. Okay. And as I asked before, are you allergic to anything? Okay. Quickly, gonna test your eyes. Can you see my hand right there in front of your eyes? Okay. Other hand, can you see that farther away? Look at me. Look right there at my hand. Here. Look at this hand. And look at my nose. Okay. Basic vital signs of your ocular motor function seem to be fine. I'm going to quickly get your temperature. You're going to hear a beep. It's a little bit cold, but I'll place it on your forehead. You'll just hear a beep. Okay, good. 98.6 degrees Fahrenheit. One more time. And you'll hear a beep. Okay, 98.6. That's actually perfect. Have you had any cold or flu symptoms recently? I have too, so don't worry about it if you have. And then I'm just going to quickly get your blood oxygen level. We have a new one. These ones look like Winnie the Pooh. Okay, give me your finger. Good. We're just going to check your pulse and your blood oxygen level. So let's count back from 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. You have beautiful nails, by the way. Looks like your pulse is resting at 78 beats per minute, and your oxygen level is at 98%. Perfect. We'll test again at the end of the exam. And let's begin with our first test, which is your olfactory sensory nerve test, which is your sense of smell. Now, that is also the first cranial nerve. I have several essential oils here that I'm going to ask you to identify. And no need to be exact or too precise. We're looking around the sensory. So if you were to smell an essential oil that to you smelled like peppermint, you can say peppermint, you can say mint, you can say candy, etc. Shall we begin? Close your eyes for this and do not open your eyes. Try not to cheat. We're just trying to test your cranial nerves, okay? So close your eyes and let's test your sense of smell. I'll remind you not to open your eyes throughout this. We'll start off with the easiest one. Keep your eyes closed and I'll tell you when to breathe in. Oh, this one smells amazing. Eyes closed. I saw that you tried to look. I put this under your nose now. And breathe in. And breathe out. This one smells amazing. Don't open your eyes. I saw that. Breathe in. Breathe out. What does that smell like? You're guessing floral. Good. Keep your eyes closed. Perhaps a bit like a spa. Okay, maybe even like skincare. Or like a perfume. That's perfect. Any guesses? I'll give you 3, 2, 1. Good. If you guessed floral, you'd be correct. You can open your eyes and take a look. It is actually lavender. Good job. You may have opened your eyes for that, so let's test with another one just in case. So, eyes closed. Don't open your eyes. Don't pass go. Do not collect $200. This one smells amazing. Eyes closed. And breathe in. Breathe out. I think you got this one instantly. What do you sense? Lemon, citrusy, fresh fruit. Any guesses? 3, 2, 1. Good. You can open your eyes and look. This next one was orange. I know you guessed that instantly. Very good. You appear to be tired, but not too tired. So let's keep testing. These will get a bit more difficult from here on out for the senses of smells. Let's use this next one. Okay. Eyes closed. I saw you try to look again. Eyes closed. This one smells amazing to me. They all kind of do. Eyes closed, 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 closed. Don't look. And breathe in. Breathe out. Keep your eyes closed. I know this one you'll want to open your eyes. Breathe in. Breathe out. This one is minty, cooling, refreshing. Ah, you got it. This one is mint, otherwise known as peppermint, so you are more than correct. Good job. This one smells exactly like candy. Okay. We're gonna have 2 more sense of smell tests now, and then afterwards we're gonna have a sense of taste. Now, if you have been sick within the past 2 weeks of being in any clinic, did you lose your sense of taste or smell at all? I did. That's why I'm asking. Good to know. Okay. We're going to test this one, which is a bit more difficult. Just try your best. Oh, this one smells good. Okay, eyes closed. You're going to want to open your eyes because it gets more difficult. Just try not to, okay? Breathe in. Breathe out. Good. What do you guess? Floral? Good. A bit like Grandma's kitchen in the late 90s. Yes, this was often seen then. Good. And breathe out. Okay. And what could this be? Floral, older scent, something that you see medicinally. Take a guess. 3, 2, 1. Okay. This one is a bit more difficult. It is chamomile, often found in kitchens and teas. And the last one will be the most difficult. Just try your best. Your absolute best. Okay? We're going to try this one. And this one's a bit of a trick. This one smells amazing, I will be honest. Eyes closed. Breathe in. Breathe out. What do you get? This one smells a bit like after it rains. Exactly. I think you're onto something. This one smells a bit like, yes, foggy weather, morning fog. Okay. And what else? This one smells a bit like herbal and herbaceous. Any guesses? 3, 2, 1. If you guessed herbal or herbaceous, you'd be correct. This is an essential oil mix called Taurus. But what it actually is cedarwood, tarragon, tangerine, rose, which all together smell exactly like the rain. Good job. I do think you opened your eyes for a couple of those tests, so I'm going to write that down. Let's move on to the second cranial nerve, which is your sense of vision. It's your optic nerve. And what I'm going to test first is something called a Snellen's chart. We have this here. And I'm going to take it about 3 meters away from you. I'm going to point at some of the letters, and I want you to try to the best of your ability to read the letters. Okay. This is pretty boring, but you got this. Okay. Can you read line 1? What's that first letter right there? Take a guess in 3, 2, 1. E. Good. Was that easy? Good. Let's move it just another meter back. Line 2. Can you read the first letter? 3, 2, 1. L. Letter 2, 3, 2, 1. T. Okay. Moving on to line 3, can you identify the first letter? 1, 2, 3. F. Line 2, 1, 2, 3. P. Letter 3, 1, 2, 3. H. Okay. I'm going to move it to the other side now to test the other eye. Can you look at line 4 for me, and are you able to read that first letter? 3, 2, 1. O. Line 2, 3, 2, 1. L. Letter 3, 1, 2, 3. C. And 4. 1, 2, 3. That is F. Good job. Okay. I'm going to just carefully move down a couple more lines and skip some of them. Just try your best to look and read. We're going to go all the way down to the second to last line. Are you able to see that first letter there? Try your best. 1, 2, 3. It's C. Third letter in, what is that? 1, 2, 3. It's D. And last letter, 1, 2, 3. J. Okay. I'm going to put it in the middle now. Take a look. Okay. What is the first letter right there at the bottom line? Take a look. 1, 2, 3. That's an L. It could be a bit difficult. Is it a bit difficult? Move it up a bit. Okay. What is this one right there? Second one in. 1, 2, 3. Unable to read? Okay, let's move it a little bit closer. Second letter in. 1, 2, 3. That's a T. Okay, so we're experiencing a bit of a distance issue, which would put you at about, I would say, 20/30 vision. 20/30 caused probably by excessive tiredness. 20/30. Okay, putting you back at the original distance, which was here. Can you read the last letter on the last line? 1, 2, 3. A little bit difficult. We'll try again up close. 1, 2, 3, H. Okay, good. So 20/30 distance. Are you currently wearing any glasses or contacts? Okay. And do you feel like within the past 2 weeks your vision has changed for the worse or the better? Okay. And any changes in your vision within the past 2 months or the year? I have a perfect ophthalmologist I would love to send you to, that's why. Okay. Next test, as we're going to be testing your ocular motor, trochlear, and abductions with your eye movements. We're going to be testing a lot of different visuals with your eyes, but before that, I'm going to get a bit close to you, and I'm going to ask you a couple of questions first, just to test your eyes, okay? Now, I'm really up close, and what I'm going to do is I'm going to ask you if my hands are getting closer or farther away from your visual field, okay? Let's start closer or farther. Focus carefully. Good. Closer. Keep your head totally still. Good. Try again. Keep your head still. Closer. And now. Farther. Good. Once more. Farther. Good. Keep your head totally still. Ready? Closer, farther. Pay attention. Closer. Good. Pay attention. Farther. Good job. Great. And we're going to test your eyes now a bit more thoroughly. And then we're going to do a combination of your eyes with your brain. Isn't that cool? Great. So, follow my fingers. Look wherever my finger moves, okay? Let's start. Follow my fingers. Good. 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 Don't get distracted by the movement. Good. 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 Don't get distracted by the movement. Just focus your eyes wherever you see the movement. Good. This is a visual peripheral test. Good, to see if your eyes can get reverse distracted from. Good. Whatever the basic movement can be. Good. Any pain or discomfort when I test this? Good. Your eyes appear to be doing well. They are moving a bit slower, which means they're getting a bit more tired, which is exactly what we're going for. Good. 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 Okay. Now, what I'm going to do is test your peripheral vision. Let me know when you can no longer see my hands and your peripheral vision. Let's start. My hands start here and I'll move outwards. So raise your hand or say now when you can no longer see it in your peripheral vision. Let's start. Now, good. Now, 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 there's still one hand. Now, and again, good. Okay, it looks like you got that perfect. And we're going to do the reverse time. Let me know when you can see my hands enter your peripheral vision, but just keep looking at me, okay? Don't look at the hands. Look at me. Don't look at the hands. Look at me. Let's begin. Now, good. Now, okay, I'm going to back away a little bit. Now, great. Now, good, a bit closer. Now. Now. And now, good. Left, right, up, down, a bit of delayed visuals. That's good. I'm going to now test your eyes in the dark. And let's turn this low as well. We're going to test your eyes now in the dark. I'm going to ask you to follow carefully. And I want you to follow this glowing circle. Just follow it as best as you can. But I'm going to watch to see if we have any signs of nystagmus in your eyes or any movements of the head or the chin. Relax. Follow the light. Follow the glowing circle. It's super bright. Good. Good. And again. Follow that. Good. And again. Follow. Good. And again. Great. Okay. I'm going to turn it a little bit lower. Follow the glowing orb. Again. Good. And again. Good. I'm going to hold your head still because you seem to be moving it side to side. Adjust your eyes, please. Follow the light. Good. And follow the light. Follow the light. And follow the light. Good. Okay, upper eye appears to have ocular motive function. That is good. Delayed reaction due to eyes closing. I'm going to ask you to try your best one more time. I'm going to adjust the bottom part of the vision now. Keep your head still. I'll hold it. Okay. Follow the light. You're doing great. Follow the light. Good. Follow the light. Follow the light. Good. So that appears to be good. Up, left, right, bottom left, right. Okay. I'm gonna draw a shape with the light. Tell me which one it is. Keep your eyes on it, but keep your head still. What shape is that? What shape is that? Look carefully. What shape is that? Take a look. 3, 2, 1. It's a circle. Good job. Okay. What shape is that? Follow. Good. Follow. What shape is that? Good. What shape is that? What shape is that? What shape? A little bit more difficult to keep following. Take a guess in 5, 4, 3, 2, and 1. Hold your head perfectly still. What shape? That's a square. Good. Take a break. We have 2 more shapes to go. Blink. 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 Okay. Are you ready for the last 2 shapes? Let's begin. Okay. Keep looking. What shape is this? Good. Good. Great. Good. Great. And what is that? Take a guess. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Good. That is a triangle. Good. We have one last one. Blink. Good. Blink. Good. Blink. Great. One last test here. With your eyes. Try your best. Keep focus. I see you're getting extremely sleepy and tired. Follow the light. What shape is that? It can also be a number. What is that? 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 Take a guess. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. That is 8. Good job. You did fantastic. This is a pen light that has 2 settings on it. We're going to give you another flashlight test now, which is called red light, green light. Now, do you have color partial vision? I do too, so if you do, that is no big issue. Color partial vision means that there are colors that you cannot see. And do you happen to have that? Okay, just try your best then. I will show you, because sometimes you can tell a difference between the shades. This light on this hand is green, and this light on this hand is red. When you see the green light, follow the green light. But if you see the red light, you have to stop all focusing and look right at the red light, okay? This is to test your brain functions and movements with your eyes, but it's red light, green light. Got it? So here's the green light on this side if you're color partial, and this is red light on this side if you're color partial. So once you see this light, all focus goes to the red light. Let's start. Follow the green light. Follow the green light. Follow the green light. Follow the green light. Very good. And stop. Good. Don't follow the green light. Keep looking at the red no matter how much you want to look at the green light. Look at the red. Look at the red. Look at the red. And stop. Follow the green light. Follow the green light. Just your eyes. Don't move your head. Follow the green light. Follow the green light. Follow the green light. Stop. Follow the green light. Follow the green light. Follow the green light. Stop. Follow the green light. Follow the green light. Follow the green light. Stop. Don't look at the green light moving. Keep focus right at the red light at the center. Don't look at the green light. Don't look at the green light. Don't look at the green light. Good. Good. Stop. Follow the green light one more time. Good. Follow the green light. Good. Follow the green light. Stop. Good job. You did great. I saw no signs of any issues with the eyes. Good job. I'm going to quickly give you a color analysis test again if you're color partial. Just try your best. But this is the color blindness portion of the test. Are you ready to begin? I'm going to put these panels over your eyes, and you take a guess what color you see. If you have color partial vision, just try your best. I'll let you know the answer at the end. But if there are colors that you used to see but you cannot see now, this is how we can discern if there's an issue with any of the cranial nerves. Let's start. What color? What color is this? 3, 2, 1. Teal, green, blue. Good job. What color is this? 5, 4, 3, 2, 1. It's pink. Pretty pink or light pink? A dark pink. Good. What color is this? 5, 4, 3, 2, 1. Blue. Very good. Dark blue, light blue, or normal blue. Dark blue. Good. 3, 2, 1. What color is that? 5, 4, 3, 2, 1. It is good. It is like a purple pink. Is it more purple or pink? A bit more pink. Okay, good. What's this? 5, 4, 3, 2, 1. And do you see the filter? Good. What color is that? 5, 4, 3, 2, 1. That's pink. Good. Let's try again. And what color is this? 5, 4, 3, 2, 1. That's yellow. And that leaves one last one. What color is this one? 5, 4, 3, 2, 1. That's red. Very good. Okay. With the red one, can you see my blue gloves, or have they turned purple or a dark red? Good. What color is my shirt? Red. What color is the wall behind me? Red. How many fingers am I holding up? What about now? Now, 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 and now. One, good. Okay. So that is the color blindness test. Not too much. Don't want to get you too tired now. Okay. And we're going to finish off with the musculoskeletal test, which is with testing the muscles in your face. Okay. So repeat after me. Okay. I'm going to ask you to raise your eyebrows as if you were shocked. Maybe as if you were playing the new Resident Evil game and you're scared, or you saw Leon. Beautiful man. Okay, raise your eyebrows and hold for 5, 4, 3, 2, and 1. Good. Okay. Can you furrow your brows like that? Just furrow your eyebrows as if you were very angry. Good. And hold. 5, 4, 3, 2, 1. Okay, good. So it looks like you were able to do that. Okay, your eyes are getting tired though. Can you close this eye right here? Close. 5, 4, 3, 2, 1. Close this eye. 5, 4, 3, 2, 1. Good. Close both eyes and hold for 5 seconds. 5, 4, 3, 2, 1. Good. Open your eyes. Look up. Good. Look down. Look to this corner. Look to this corner. Look up again. Look down. Good. Great. Good. Don't flinch. Good. And now, look at me. Good. Give me a smile as if you saw Leon Kennedy. Like that. I'm kidding. Just give me a good smile as if you were happy about something. Good. I can see teeth, which is a good sign. Okay. Can I just carefully pinch right there? I'm just going to. Good. Other side. Good. Okay, look at me. Give me a frown like this. Good. Just a little frown. Okay. Relax. Can you do this for me? Okay. And go 3, 2, 1. Good. I'm going to just feel the lymph nodes now. Any soreness or achiness here. Okay. Pressing on the shoulders. Can you feel that? Raise your shoulders, but I'm going to press down. I want you to resist, okay? Resist. 5, 4, resist. 3, 2, resist. 1. Good. Shake my hand. Shake my other hand with your other hand. Okay. Good. Place your palms up. I'm going to push my hands down on your hands. I want you to resist. 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 Resist, resist, resist. Good. Okay, I can tell that you are thoroughly tired now, and that is the end of the test. I'm going to retest you about 2 to 3 more times, just over again during the duration of your stay here at the Dream City Sleep Clinic and Brain Clinic. That's where I come in. We're going to test to see how this affects your sleep and if any of your results change throughout the duration of your stay here, okay? Now, I want you to have a beautiful rest of your night. We're going to continuously re-wake you up during different segments where we're going to retest you to make sure that you're sleeping well. But we're going to first allow you to get the first 8 hours of sleep, and then we'll proceed with the rest of the tests, okay? I'll send you all of your amazing results because you were a superstar today. As well, you'll get a gold star on your report card. So, your report card will have a beautiful star saying you were a great patient, and we're going to reanalyze your results whilst you sleep, okay? I'm going to finish some notes here, and then I'll send you on to the next person, okay? It's great to see you. I'll see you again soon. Ciao, and thanks for staying for the best and most detailed cranial nerve exam. We will be charging your insurance, which means more for me and better for you. Dream City Clinic. Are you here because the nurse sent you on in for the most detailed cranial nerve examination? Perfect timing. I'm Dr. Brain. Pleasure to meet you. I'll explain everything. Just first, sit and relax. Good. Are you cozy? If you need anything like a blanket or a pillow, let me know. Great. So, looking at your chart here, it looks like your primary care provider has assigned you to me because you fell asleep watching a movie, rolled off the bed, and bumped your head, causing you to lose sleep. Don't worry, that's a common story. We hear that all the time, okay? And how are you feeling today? May I just carefully touch your face? Okay. And does the bump feel okay? You're just really tired and you need to figure out what's going on. I'll have no worries. This exam we're gonna go through today will help you with that. It's gonna be super detailed. I'll tell you what we're doing. So, we're gonna be doing your full cranial nerve assessment of all 12 of your cranial nerves. We're also going to test every sense of them: smell, taste, touch, sight, etc., to make sure everything else is going on properly, and test to see how sleepy you get. And finally, we're going to go through specific optic tests to make sure nothing is going wrong with your eyes, and also as a way to aid you to find sleep. Okay? Good. I'm going to keep this up next to me so that you are able to just relax. Okay? And before we begin, a couple of questions. How much sleep have you been getting lately? Your eyes do seem to be just a little bit red and irritated and tired. That's okay. No one's going to judge you here. Do you have any allergies I should be aware of? Okay. Fruits and foods are also allowed on this list, so any allergies, let me know. Great. All this information will only be between me and the computer. And last question here, it's just right there on my list. Could I get your date of birth with the year? Okay. Does that make you a Capricorn? Perhaps not, or perhaps. I'm trying to learn these things. Fabulous. Okay. I'm going to begin first by getting a pair of gloves. And we're going to start, okay? I'm going to first test your eyes and get some vitals. Are you doing okay today? If you need anything, let me know. Pillows, blankets, whatever. So, first vital. I'm just going to get a little look at your eyes, okay? They might be tired, so if you want to close your eyes at all, you can. So, I'm going to cover one eye. Let me know when you can see the light. Good. You can see the light there? A little closer. I'm just looking for your pupils to dilate. Pull away. Good. And again, just look for the light. And pull away. Okay. Other eye. Can you see the light? Is it super bright? There are also lights in this exam room. Okay. Can you see the light here? see the light now? A little closer. What if I move it farther away? Good. Okay. Your pupils seem to be dilating properly, which is a good sign. This part's a bit tiring, but it is vital. Can I ask you just to carefully follow the light with your eyes? We'll do more of a detailed test of this later, but it's just to see if your eyes can move properly, okay? Okay, just relax. I'm gonna hold right there next to your chin. Can you follow the light for me? Good. I know it's a little bright in this room. Follow that light. Good. At the center. On this side, a little closer. On that side, and the center. Great job. So, write that down. Your pupils seem to be reacting well to light, which is a great sign. I didn't see any signs of nystagmus, which is shaking of the eyes. Okay, I'm going to carefully get your temperature now. Is that okay with you? Just a couple of vitals. And it's going to be a little cold because this device has glass at the end. I'm just going to brush it against your forehead and you're going to hear a click. Let's start. Okay. Looks like you're 98.6 degrees Fahrenheit. Let's try that again. Okay. And that seems to be collaborating perfectly with our temperature. Do you feel like you're very cold, or do you feel like you need to shiver at all? You're good. Okay. And just say ah. One more test. Say ah. Ah. And relax. Okay, well, that one is at 100. That is perfect. Thank you. Okay, so those seem to be good. We're just going to quickly get your blood oxygen level with this pulsometer. I'm going to attach it to your finger and we'll count down from 10. So give me your finger right here. And I'm going to clip that on. Hold for 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Okay. And it says your blood oxygen level is at 98%. Spectacular. Okay, that's great news. I'm just going to get your heartbeat really carefully, okay? So, what I'm going to do is listen to your heartbeats, just to make sure everything is going on there. It's going to be a little cold, but I'm going to place it at either side of the shoulders, okay? Okay. And breathe in. Breathe out. And let's listen. That sounds great. Let's try the other side now. Over here. A little cold, I'm sorry. Breathe in. Breathe out. And let's listen. Good. Great. Good rhythm. Good. So the heartbeat sounded good. I'm just going to listen for your stomach now. Just relax. Right there. Okay. Good. Good. Great. Your stomach sounds fine. Have you had any issues with your tummy at all? Any sorts of pain while you eat or anything I should know about? You're good. Okay. I'm going to place this on your back now to listen to your lungs. I'll let you know when to breathe in and breathe out, okay? Good. Again, could be a little cold. Just relax, okay? So, right back here. And I want you to just carefully, right there, breathe in and breathe out. Good, let's move that. Breathe in. Breathe out. Breathe in. Breathe out. And one more corner. You're doing great. Breathe in. And breathe out. Okay, good. So, your lungs sound great. And it also appears that your heart sounds good too. It's great news to me. And what we're also going to just check, one more thing that's just a quick vital, is just a quick reflexology test. I'm just going to tap this on certain parts of your face. Just let me know if you feel the tapping, okay? Right here. Could you feel that, yes or no? Good. What about there? Yes or no? Great. On your nose, just right there. Yes or no? Good. Here. Yes or no? Here. Yes or no? Okay, then right at the center. Good. I'm glad. We're going to start off now with some official tests. Are you ready to begin? Let's start. We're going to start off first with testing your eyes. The first test we're going to go through is something known as your vestibular, and that's with your vision. Okay, so I'm going to pull my pen light out again, and what we're going to do is we're first going to go from the side of the ear. You're going to hear my hand move close to it, and let me know when you see the light first coming around the side of your ear. For example, you won't see the light here, but you'll see it right there. Sound good? Okay. I'm just going to go right next to your ear. Can you hear that? Good. Okay. And then let me know when you see the light. Right there. Okay. Okay. Can you hear my hand right here? Good. And let me know when you can see the light. There. Good. I'm going to start off at this side of the ear again, and let me know when you can hear my hand. Good. Right there. Good. Let me know when you can see the light. There. Okay. One more time, let me know when you can hear my hand. There. When can you see the light? Good. Okay. Looks like your ears are also functioning with your eyes there. That's great. Can you look at me? Look at my forehead. job. Look at me. Look back at my forehead. Checking to see if your eyes are moving up and down. Good. Look right there at my nose. Chin. Nose. This eye. Look at that eye. Look at this eye. Look back to my forehead. And look back at my nose. Okay. Very good. Can you look right at my finger right there? Good. We're going to test your trochlear nerve now. Follow my finger all the way here. Good. Follow it all the way here. Good. Follow my finger back to the center. Good. And then follow my finger there. Okay, great. I'm going to drop the light a little bit lower here. And we're going to test the trochlear nerve a little bit more with the light slightly dimmed. Okay. Can you see the light right there? Can you follow it up? Okay, follow it down. Follow it back up again. And then follow it back down. Great. Let's drop this light just a little bit. Okay. Can you look at the light right there? Follow it up. Follow it down again. Follow it up. Follow it back down. And follow it up one more time. Okay. Okay. Right at the center. Look right there. Okay. And then can you follow the light all the way up? Okay. Can you follow the light down? We're trying to move the light up, down, sideways and diagonal to gauge and make sure that the cranial nerves are working well with your trochlear nerve. That's with the motor movement of the eye. Let's try diagonal now. Can you follow the light? Good. It's a little bit tedious and slow. Just follow the light. Okay. Let's try diagonal the opposite direction. Now you're doing great. This should be making you a little bit tired as well as it is a little tedious. You're doing fabulous, okay? Okay. On this side, follow the light. And diagonal. Just doing great. Follow the light diagonal. And opposite direction. Good. Diagonal. Opposite direction. And diagonal again. And back down. Great. Okay. What I want you to do now is I'm going to draw a shape with the light. It's going to be one of the three: square, triangle, or a circle. It's going to use all the mixture of every trochlear nerve and see what shape you get. So what shape is it? Let's start. Look at the light. What shape is that? Keep looking at the light. Follow it. Good. And what is that shape? Square,
circle. Good job. Let me write that down. Okay. Again, square, circle, or triangle. Let's start. Follow the light. Good. Follow. Good. Good. Square, circle, or triangle. Let me know on 3, 2, 1. A square. Good job. So far your results are fabulous. I do see here as you are attached to one of our heart monitors that you are getting a bit tired as your heart rate is slowing. Are you feeling a little tired? That's good. Now square, circle, or triangle. I could either repeat a shape or go to the next one, so pay attention carefully, okay? Square, circle, or triangle. Let's go. Follow the light. Good. Follow the light. Follow the light. Follow the light. Good. Follow the light. Follow the light. Square, circle, or triangle. Let me know in 3, 2, and 1. Triangle. Good job. Splendid. You're doing great. So, I'm going to raise the lights again a little bit in the room. You did amazing. What we're going to test next is a quick color blindness test. And this will be testing carefully placing these over your eyes. Let me know what color you see. Do you happen to have any color partial vision? Because I do too. There are certain shades of pink and orange and purple I cannot see. So do not worry if you're unable to tell them. Just try your best. Let's start. Okay, so what color is this panel? I'm going to place this over your eyes. Good. Let me know. What color is that? 5, 4, 3, 2, 1. Okay, this one is blue. Were you close? That's okay if you weren't. Let's try again. What color is this one? Let me know in 5, 4, 3, 2, 1. What color is that? It's green or green blue. Good. Did you get that? You're doing great. Do not worry. Okay. What's this color for the panel? Place it over your eye. Let me know in 5, 4, 3, 2, 1. Purple. Good job. Okay. A couple more left. Are you doing okay? Good. What color is this panel? I'm going to place place it over your eye. Let me know in 5, 4, 3, 2, 1. It is yellow. Good job. So far, how many did you get out of 4? Okay. So I'm going to get to the primary colors now. I'm just writing your info down. Stunning. Okay. And what color is this one? Let me know. 5, 4, 3, 2, 1. Good. It's like a light pink. Good. 2 more left. What color is this one? This one's ever so slight. Let me know in 5, 4, 3, 2, 1. Good. This one's a light orange or yellow. 2 left. These are going to be the most obvious. Are you ready? What color is this panel? 5, 4, 3, 2, 1. This one is pink, otherwise known as hot pink. Great. And is everything flooded with color with this panel? It is. Good. Okay, great. And we have one last one here. I have to prepare my light as we're going to do a test with it. So, we have the last one here. I'm going to put it over your eyes now. Take a look. Let me know. What color is this one? 5, 4, 3, 2, and 1. It's red. Good. We're going to do a red color field vision test now, okay? Let me know. Do you see the light? Yes or no? Okay, and let me know when you can no longer see the light in your vision. There. And again. Look at the light. Let me know when you can no longer see it. Good. Again. Good. And again. Good. With this red color field vision test, let me know, is the light getting closer to you or farther away? Look carefully. Closer. Let's repeat. Closer or farther away? Farther away. Again. Closer or farther? Look carefully. Farther. And again, closer or farther? Closer. Good job. Okay, let's remove the red panel. You did fabulous. I'm not surprised, because so far your results have been spectacular. You're doing great. Okay, we're going to move on to the best test in my opinion. It's called the Olfactory sensory nerve tests, which is your sense of smell and your sense of taste. Then afterwards we're going to just test a couple more ocular motor and optic ones, etc. We're even going to use this little Snellen's chart behind me, okay? Good. So, let me tell you what we're going to do. I have essential oils here of all different kinds. I'm going to choose them at random, and they're very commonly used essential oils, so you won't be surprised. What I want you to do is try your best and take a guess what essential oil do you think you're smelling? And they're going to be really basic, so don't worry. Nothing super difficult, just super basic ones. And I want you just to give me guesses of what you think it could be along the way. But if possible, do you think you could keep your eyes closed as to not spoil the surprise and find out by reading what the essential oil is? Good. Are you ready to begin? Close your eyes. Now. Close. Close your eyes. Don't peek and don't take a look. Good. Keep your eyes closed. I'm going to choose one at random. If you open your eyes, it will be obvious. Let's start off with this one. Eyes closed. Don't take a look. And let me know what you think. You smell this one, smells amazing. I'm going to place it right under your nose. Breathe in. And breathe out. And what could this one be? Eyes closed. Good. You smell citrus. That's a good guess. Like a lemon. Okay. Something fruity. Good. Any guesses? 3, 2, 1. Did you guess orange or a citrus fruit? Then you're correct. Good job. This one smells amazing, so I knew you'd get that immediately. And no worries if you can't get this correct. Just try your best. On to the next one. Let's see. Eyes closed. Don't take a look. Let me know what you smell. Stunning. Breathe in. I'm putting it right under your nose. And breathe out. Breathe in. Breathe out. Keep your eyes closed. I saw you almost open it. Any guesses? Floral. Good. A bit like a bouquet of flowers. Great guess. Like summertime a little bit. That's good. Floral perfume. Great. Any guesses? 3, 2, 1. Good. This one was rose. Floral was absolutely correct. You did great. Write that down. Floral. Okay. On to the next. Are you ready? Keep your eyes closed. This one is super strong. You might get it immediately. Wow. Breathe in. Breathe out. It's right under your nose. Breathe in. And breathe out. Any guesses? Smells like a bakery. That's really a great guess. Smells like, okay, a bit like a gourmand perfume in a way. Yeah, like a scent. It smells like cookies. That's such a good guess. You're on the nose. And it smells like, yes, like a bakery. That's exactly it. Take a guess in 3, 2, 1. is vanilla. And you are perfect. It smells just like a bakery. Good job. On to the next. Okay. I think this one's going to be great. Eyes closed. I see you almost want to open your eyes again. This one is next. Let's open the bottle. That smells amazing. This one might also be obvious. It's right under your nose. Breathe in. And breathe out. Once more, breathe in. Breathe out. What could this one be? It's cooling. Yes, it's refreshing. Reminds you of a candy. Yes, that's very true. Makes you feel cold a little bit when you breathe in. That's accurate. And it smells a little bit like... Exactly. Take a guess in 3, 2, 1. I'll give you a hint for this one if you didn't get it at 3. There is an ice cream flavor, but they mix this flavor with chocolate chip. Did you get it? I'll let you guess again in 3, 2, 1. It's peppermint or mint. Did you get it? Good. The ice cream is called mint chocolate chip. Let me write this down. So far, you're doing great. And we have 2 more scents here, and one of them is pretty difficult, but I think you've got this. Okay. Let me write this down. Okay. Second to last, eyes closed. This is the scent of this essential oil. Eyes closed, don't look. That smells so good. Okay, breathe in. Breathe out. This one's right under your nose, but I'm going to put it a little bit farther away because it's very strong. What does this one smell like? Perfume. Great guess. Perfume is accurate. Like a spa? That's a great guess. They use this frequently in spas. Breathe in. Breathe out. It smells like perfume, like a spa, like flowers. Do you need a hint? They often use this as teas. They will add this to teas, especially with chamomile tea, to help you sleep. Any guesses? Take a guess. It is a flower. Take a guess in 3, 2, 1. Did you guess lavender? You can open your eyes and look at this one. Good. Flower is correct. And then I'm going to give you the last one. Again, this one might be pretty difficult. Just try your best, okay? Okay. I want you to try your best. It's going to be a bit confusing. But I don't expect perfection. Eyes closed. Good. And this is the essential oil. Okay. I'm going to give you a little extra time, and if you need a hint, I will give it to you. But this one smells fantastic. I love this one. Okay, are you ready? This one's challenging. It's right under your nose. Try not to open your eyes as you'll be tempted to because it's difficult. Breathe in. Breathe out. Breathe in. And breathe Okay, a bit like citrus, a bit like lemon. You're on the nose with that part. But a bit herbal. That's correct. A bit herbaceous, like a cooking ingredient. I think you're getting there. Do you want a hint? Difficult. It's often used in soups, and it's often used as a cooking ingredient to add flavor. Any guesses? You might get this incorrect, but that's okay. That's why we throw a difficult one out there. One more time, breathe in. And breathe out. Any guesses? 3, 2, 1. You can open your eyes. This one is lemongrass. I know it's very difficult, but you did great. Lemongrass has 2 certain flavors or smells. Citrus, like a lemon, and then this herbal type of smell that almost smells like, in my opinion, very similar to a tea tree. I think you did fantastic. Good job. Are you ready for your taste test now? You are? Okay. And let's get some of these taste tester bottles now. So, I have 3 bottles, and they all look the same. Each one has a different flavor. Okay. So, they all look the same. They have a different flavor. One of them is sour and has lemon in it. Okay? Another one is sweet and it tastes like strawberries. And the third one is water. Neither sour nor sweet. Are you ready? Let's choose it at random. So, let's start. I'm going to choose one at random, and you won't be able to tell. Okay. Are you ready? Is it sour? Sweet? Or water? Say I'm gonna just drop a couple of drops. And taste. Okay, good. I think you got it. Sour, sweet, or water? Water. Good. Okay, let's grab the other one. Okay. And taste. Sour, sweet, or water for that one? Good, it's very good. Sour. I saw your face do that. Okay? At random. Sour, sweet, or water? Say and taste. Sour, sweet, or water? Let me know in 3, 2, 1. Sweet, you taste the strawberries. Okay, then I'm gonna repeat one. Just try your best. Sour, sweet, or water? Are you ready? say ah. And what was that? Good, that one was sour. Very good. I always test that one twice. You're doing great. Okay, what we're going to do now is we're going to test your glossopharyngeal nerve. That is right along the neck, and it's with the way that you pronounce words. Okay? Relax. I want you to pretend to yawn for me. Okay? Try. 3, 2, 1. Breathe in and yawn. 3, 2, 1. Good. Relax. Okay. Good. Let's feel right around the lymph nodes. Here. Any pain or sensitivity when I touch right around the lymph nodes? Okay, let's right there. Right at the shoulder. Let's see. Any pain or sensitivity? Okay, right there. Any pain or sensitivity? Okay. Look back at me. Can you say ah? Okay. Try ah. 3, 2, 1. Relax. Now say oh. Oh. 3, 2, 1. Relax. Show me your teeth. Go E. E. 3, 2, 1. Relax. And then if possible, I just want to take a quick look at your teeth. Can you say ah? Ah. Relax. Teeth look fine. Any pain or sensitivity? Okay. Keep saying ah. 1, 2, 3. Relax. Okay. And can you just relax? I'm going to put my hands right here. And I want you to clench your jaw. Clench and hold for 5, 4, 3, 2, 1. Great. Good. Okay. Now, I'm going to test your ears. I want you to let me know when you hear me make this sound. Okay. And that sound is just the sound of my hands moving on the gloves, but you won't be able to see it because I'll put them right next to your ears. Either lift your hand or let me know now when you can hear that sound. Good. Let's start. Okay. Let's test your ears. Let me know when you can hear the sound. Good. Again. And again. Good. Next sound I'm going to make is this. Let me know when you hear that sound, okay? Listen carefully. Good. Again. Good. Again. Good. And again. Good. Okay. Next, I'm going to make a sound, and I'm going to pull the sound away. Let me know when it starts and when the sound stops. Let's start. Good. Again, starts and stops. Good. Stop there. Okay. And one more sound. I have this little keyboard here, small one. When does it start? And when does it stop? Let's go. Great, right then. Fabulous. Let's write that down. Okay. We're going to test your sense of hearing now. I'm going to move my hand on one side of your ear, but I'm going to whisper a word. I want you to repeat the word once I'm done. Okay? Close your eyes and let's begin. Repeat the word. Sleep. 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 And what was the word? Sleep. Very good. Let's try that again with a more difficult word. Okay, eyes closed. Okay, and listen carefully. Blanket. 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 What was the word? Blanket. Okay. Okay. One last word. It's going to be the most difficult. Eyes closed and try your best. French fries. French fries. French fries. French fries. French fries. French fries. And what was the word? French fries. Very good. Okay, you're doing great. Last step of your hearing test. I have 3 of these devices here. These are known as tuning forks. They kind of look like a fork as well. I'm going to tap it on my hand and it's going to make a sound. All I want you to do is let me know if you can hear that sound or not. Sound good? Great. Let's go. Can you hear it? Round 1. Listen carefully. Yes or no? 3, 2, 1. Again. Let's start. 3, 2, 1. Can you hear it? Good, you can. Okay. Round 2. Listen carefully. 3, 2, 1. Yes or no? that? Let me know in 3, 2, 1. You can. And round 3, this one's going to be the most difficult. Typically humans can't hear this specific tuning fork, but you might be able to. Let's go. Okay, there we go. Can you hear that? Let me know in 3, 2, 1. Maybe not so much. Let's try again. Okay. And can you hear that? Listen carefully. 3, 2, 1. Not so much. Okay, that's good. We always test to the limits just to make sure that we double and triple check everything. Okay, and we are on to our last test here, which is your facial nerve. I'm going to ask you to raise your shoulders and your eyebrows at different parts of your face. Just try your best to see if we can do that and accomplish it, okay? Let's start. Raise your eyebrows and hold. Just like this, like you're shocked for 5, 4, 3, 2, 1. Relax. Good. Now, furrow your brows as if you are a little bit upset, like this. Hold. 5, 4, 3, 2, 1. Relax. Open your eyes super wide like this and keep them open. 5, 4, 3, 2, 1. Now do the opposite. Close your eyes. I'm going to try to open them, and I want you to resist for 5 seconds. Close both eyes. Resist. 5, 4, 3, 2, 1. And relax. Good job. Now, I want you to open your eyes normally. Blink one eye. Blink. Blink the other eye. Blink. Blink both eyes at the same time. Blink. Good. Give me a smile like this, showing your teeth. Hold. 5, 4, 3, 2, 1. Relax. Give me a very sad frown, like a cartoon. And try for 5, 4, 3, 2, 1. And relax. Good. Raise your shoulders. I'm going to try to push your shoulders down. I want you to resist. So raise your shoulders. Resist. 5, 4, 3, 2, 1. Relax. Shake my hand. Good. 5, 4, 3, 2, 1. And the other hand. Shake my hand. 5, 4, 3, 2, 1. Okay. Those were all your cranial nerves. I'm so happy to have been your primary care physician today. I'm going to just sit here now and watch you for a couple of minutes and analyze your results. And then afterwards, we're going to send you to the sleep clinic to analyze your sleep. In the morning, we'll give you the results and let you know how everything goes, okay? Thank you so much for coming to the clinic today. Again, I'm Dr. Brain. Pleasure to meet you. Your cranial nerves seem to be fine, but we're just going to refresh and analyze the results for the next couple of minutes while I'm finishing my paperwork.